Cameron, you know, heaven forbid, but say somebody's just been in a mild accident and they've just lost, for example, one tooth. Now, I guess the option is there to leave it or to get it fixed somehow. What are your recommendations?
Well, right. I mean, doing nothing is always an option. That's been around for ages.
Yeah.
And it's okay. Is it best? Is it what people want? No. So a lot of it's going to depend on your situation. I can speak to kind of general terms of what's best for your long-term health. Replacing it's definitely going to be better because all your teeth function all together. They work best that way. You lose one, the rest are going to try to pull its weight, and they're going to suffer consequences. Maybe not initially, but over the road they will. Over the long term they will. Your best option, and a lot of people are familiar with the term, is a dental implant. Okay, it's we like to say it's a single tooth solution for a single tooth problem. You're just replacing with the best thing we have what you lost without involving anything else. You can involve other teeth and do a bridge. That's still a very viable and acceptable option. Right. Is it the best long term? Probably not. Again, depending on your situation, but I'd say 9 times out of 10, if you can do an implant, that's going to be your better bet.
Okay. What does an implant for just one tooth involve?
So typically, now you can do it all in a day. That's got its risks and its benefits that you ought to discuss with your dentist. If you've heard about that option, we need to make sure we know what the pros and cons are to that. But it's doable. But you put basically like a titanium screw goes up in the bone where your tooth root used to be. Okay, and that kind of replaces the root. And then there's a connecting piece that we call an abutment that screws into the implant. And then you put a crown like you could on a tooth onto that piece. So it's 3 pieces. Typically, there are variations, but that's typically how it goes. So someone that got in an accident, if the tooth has already come out, it's been a while, we'd look at the area and say, okay, if the bone around the area has remodeled because you've lost it, like if someone's in a cast, right? They take the cast off, their arm's tiny. It didn't used to be that way. What's not being used by the body just tends to go away. Okay, bone, if it's not used by a tooth, tends to just kind of dissolve a little bit. We might need to build that back up with a bone graft, okay, giving you back what you lost. Yeah. Then you put the implant in. That's typically the major surgery. And then later on, after that implant actually fuses to your bone will grow into all those threads and lock it in place. Okay. That's why it's such a long-lasting solution. Right. Then you do the rest. It may be 3 to 6 months, depending on where it is in the jaw, and you'll be good to go.
So you talked briefly, and we touched just briefly about what would happen if we just left that gaping hole. Yeah. Now, what does happen? Why would that not be an ideal situation?
Well, so for example, depending on where you're missing it. Now, most people get it if it's a front tooth. Most people in where we live are pretty motivated to replace a front tooth. It's your smile. Right. So that's usually not hard to explain to someone, hey, you want your smile back. Right. The back is what tends to get neglected. Okay. And people say, well, no one sees it, right? Yeah. Absolutely. People don't necessarily see it. Right. But once you're missing a tooth, now there's the possibility, it doesn't always happen, but other teeth can move. The tooth that comes and bites against it may move up a little bit or down depending on what's missing into its place because it wants to touch something to rest there. The tooth behind it may start to kind of tilt a little bit into its space. The biggest consequence that always happens is the bone surrounding where that tooth was shrinks because it's no longer being used. It just atrophies and you lose a little bit of it. And that's why the sooner you get to replacing something you've lost, the better. You may be able to eliminate that step. Right. But it's not the end of the world. We can still help you. Yeah. It's just it may be an additional surgery that's an additional inconvenience and an additional cost.
Right. And it sounds like things just might kind of go out of alignment if you've got teeth moving around it.
Well, for sure. I mean, things either the top may move, the teeth around it may move, and then it's no longer ideal. And also, your other teeth are going to bear the weight. You used to chew everywhere. Right. Well, now you only chew where you have teeth. And so the other teeth take more abuse, and over the years we see those teeth get more fillings, they get more crowns, and with more root canals, just they need more care because they're carrying more than their natural load.
So although this might seem an expensive option to start off with, not that it's super expensive, but it may seem, rather than just leaving the hole, in the long run it's going to save you A, discomfort, and B, financially.
Absolutely. I mean, as dentists, what we see is we see people all along the path, right? So you just broke a tooth, you come in, things may be tight for you financially at the moment, and you're thinking, that's too expensive. Well, what we're thinking is also, well, long term, what are the costs going to be for you by losing it and not replacing it? So, I mean, in the end, it's always your call. It's your mouth. But we're going to advise you to do what's best for the whole mouth as a whole, and that's going to be to replace that missing tooth, and an implant's your best option.
Okay. So if you do need just the one implant, or of course many more, tell us where you are, Dr. Cameron, and how somebody can come in and get this taken care of.
Sure. So we're right across from the Cache Valley Mall, across 1400 North. Just give us a call, 753-4400, or visit us aspendds.com, and we'd be happy to give you all the information you need, help you feel comfortable with whatever you decide is best.
Okay, so no need to look toothless anymore. This can be fixed these days, guys. Come in and see Dr. Cameron here at Aspen Dental. Thanks, Dr. Cameron.
Thank you.